Shows obesity rates rose across much of the country during the pandemic. In Illinois, just over 32% of adults are obese, and this can have a lasting impact on health, especially since obesity is a major factor in COVID-19 outcomes. Joining me now to talk about this is Dr. Mark Loafman. He's the chair of Family and Community Medicine for Cook County Health. Dr. Loafman, so glad to have you with us tonight.
Thanks for having me, Gaynor, and I'm really glad you're talking about this important topic.
So let's start with this. What did you make of this study, and, why are the obesity rates happening, or rising, I should say?
Right. Well, I think I'm sorry to say we weren't surprised about the study. I think it's worse than we had hoped for better news. It's a trend that's been happening some time, and I think most people believe that the COVID pandemic just aggravated factors that were already there. And you talked about, what's causing it. The epidemiology tells us that this really is associated with sedentary lifestyles and a much more active, easy approach to fast food and processed food. And it's particularly true in some of the more underserved communities where that is just very relevant factors.
So how urgent is this issue of obesity right now, especially as we are still, unfortunately, in the thick of the pandemic? And we know that obesity can lead to more severe outcomes for people who get COVID-19.
That's for sure. Yeah. Not only does it increase heart disease, stroke, causes of cancer, but yes, it's been a big risk factor for COVID severity as well. So I think it is urgent. It's important, and we really want to approach it from a positive restructuring lifestyle point of view. I think so many times we look at obesity as a bad thing and treating it as punishment, but it's really important to get our health back. Which is to get some of the weight off. And we really think it is an urgent issue that needs attention right now.
And I think it's important for you to remind us how is obesity clinically defined? How is obesity different from being overweight, for example?
Right. Well, we go by body mass index, which correlates height to weight. And it's based on the epidemiology of what normal values are and then what values are associated with some pathology or associated with complications. So, a BMI category over 30 to 35, that's the number of the ratio of height to weight is where we begin seeing increased health consequences. And the higher the BMI, the worse the consequences are, with a very direct relationship. So knowing your BMI is important and seeing kind of where you should be, and then looking at what that trend has been over the last year or two, to see if you can't change the trend. We at least want people to try to not gain any weight right now. If you can just stop the weight gain, get started there, maintain that, rather than trying a crazy hardcore diet. Just stop gaining weight right now.
So you talked about access to healthy food options, food insecurity. What are some of the things that can be done from a public health standpoint to really address this issue of obesity?
Well, yes, we know a lot of this has to do with insulin resistance and sort of central or truncal obesity. So I think foods that contribute to that are really the highest risk to get away from. So highly processed foods, sugary foods, foods that are high in fat and high in simple carbohydrates. Those really have little food value, and they have a high caloric content, and they tend to promote weight gain rather than loss. So I think everybody should be a little bit of a student of healthy diet. There are many, many healthy diets out there that are accessible, but trying to sort of get some of the higher risk foods off the diet and bring some of the lower risk foods in is the perfect way to start.
All right, Dr. Mark Loafman with Cook County.